Sure, thank you. Paul, we're ready to go. (2020) order suspending certain provisions of the open meeting law, Mass General Law, Chapter 30A, Section 18, and the Governor's March 23rd, 2020 emergency order imposing strict limitations on the number of people that may gather in one place. The Board of Health meeting will be conducted via remote participation by the board. Sure, thank you. Paul, we're ready to go. The meeting will be live streamed by Westwood Media, and the public can view the meeting by accessing the YouTube link. Our government channels will be broadcasting certain provisions of the open meeting law, General Law, Chapter 30A, Section 18, and the Governor's March 23rd, 2020 emergency order imposing strict limitations on the number of people that may gather in one place. Our government channels will be broadcasting the meeting on Comcast Channel 12, Verizon Channel 42. Paul, we're ready to go. All right.
That should
Paul,
be fixed. Try that now.
We're okay now? All right, let's start. Take it from the top. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, Mass General Law, Chapter 30A, Section 18, and the Governor's March 23rd, 2020 emergency order imposing strict limitations on the number of people that may gather in one place. The Board of Health meeting will be conducted via remote participation by the board. The meeting will be live streamed by Westwood Media Center, and the public can view the meeting by accessing the YouTube link. Our government channels will be broadcasting the meeting on Comcast Channel 12 and Verizon Channel 42. The public is encouraged to watch our meeting via the Westwood Media Center live stream. The public will be allowed to make comments if they wish to do so during the portion of the meeting designated for public comment by using the raise hand function. The chair will continue to give guidance and instructions as needed. Every effort will be made to ensure that the public can adequately access the proceedings via technological means. In the event that we are unable to do so, despite our best efforts, we will post on the town website, www.townhall.westwood.ma.us, an audio or video recording or transcript as soon as practicable after the meeting.
Thank you. Heading down the list, I guess we should say we've called the meeting to order. Have people reviewed the minutes?
Yes.
Do I hear a motion to accept the minutes as they are?
Make a motion to accept the minutes.
I'll second that. All those any discussion? Hearing none. All those in favor of accepting the minutes as written, please signify by your name and signifying A or nay.
Go ahead, Carol.
Carol's on mute.
Accept the minutes.
I second
I'll
it.
second that.
Shelley Reaver, I accept the minutes.
Roger Christian accepts the minutes as well. Those in favor of accepting the minutes as written, please signify by your name and
Hi, Carol Ahern.
Go ahead, Carol.
Yeah. Can you hear me?
Carol's on mute.
I know.
Paul, do you know why we're getting so much feedback?
We're getting some feedback from Carol's microphone just because the volume is turned up very loud. So our voices are being picked up and then rebroadcast.
Okay. Yeah, Carol, can you turn down your volume? Maybe that'll help us when you're speaking. Okay. All right. So did all three of you affirm? Paul, do you know why we're getting so much feedback?
Yes.
We're getting some feedback from Carol's microphone just because the volume is turned up very loud.
Okay.
So our voices are being picked up and then rebroadcast.
Yeah, Carol, can you turn down your volume?
I did.
Maybe that'll help us.
Yeah. Can you hear me?
When you're speaking? Okay.
Okay.
All right. So did all three of you affirm? Paul, do you know why we're getting so much feedback?
Hi, Carol Ahern.
We have all affirmed.
multiple times.
All right, the appointment of burial agent, Dorothy Powers.
Yes, we hear.
Any discussion about appointment of Dottie Powers as the burial agent? We just have to say we accept her.
It's a roll call vote.
All right, all those in favor say aye.
Aye. Aye, Shelley Reaver.
And I, Roger Christian.
Appointment of
Aye.
Dorothy Dottie Powers.
All right, go ahead, Carol.
Right?
Okay.
All those in favor say aye.
I, Carol Ahern.
Okay. All right, I think
Okay.
we're,
So I'm having a problem. Can you hear me?
And I, Roger Christian.
Okay.
yeah,
It keeps repeating and echoing. Can you hear me okay?
Carol, are
Yes.
you watching our stream on YouTube or on television? You have that on
No,
in the background?
no, there's no background. I, Carol Ahern.
We
So
can
Paul,
hear
did
it
you
coming
hear
up.
that? It just repeated.
All right, I think we're.
Should I look? I'm having a.
Do you have any other web page open, like YouTube or anything?
No.
Keeps
repeating and
do you want to log out and log back in?
Do you want me to do that?
Hear me okay?
Yeah, and then we'll bring our guests over and you can just stay on mute while they're presenting anyway, so that's not gonna be a big deal. Do you wanna?
Okay, so I'm gonna leave now.
Okay,
So Paul,
all these months we were doing great. Now that we're rounding the bend with these Zooms, it starts to act up.
Had it like everyone else.
Can you really call it feedback? Feedback is usually a really quick loop. This is a delay.
It's endless too. It just keeps going and going, right?
Right.
Couldn't do it if we tried.
Yeah, it almost sounded like it was replaying in the background, but it
Yeah.
was very delayed. So I don't know if it was feedback.
And with these Zooms.
okay, so I'm back.
All right, Carol.
Okay,
Okay, I'm gonna mute.
yep. All right, so Paul, we can bring our guests across and we'll give them a short introduction and let them make their presentation.
Yep, they are being promoted.
Thank you. All right. I see two. Enjoy. Michael. Okay. Looks like you're all here. Perfect. So welcome to our monthly Board of Health meeting. Let me reintroduce myself and the rest of our group here. My name is Jared Orsini. I'm the health director. We are joined by Margaret Sullivan, who is our public health nurse, Jason Belmonte, who is our inspector sanitarian, Dr. Roger Christian, who's the chair of the board, Carol Ahern, the board member, and Shelley Reaver, board member. So I'm not sure who.
I'll take it, Jared.
Okay.
My name is John Maservi. I'm the Corporate Director of Design and Construction for Mass General Brigham. And John Castrinos from Haley and Aldrich will be speaking today about the technical aspects of geothermal wells. We also have Joy Clark and Michael Knoll from Leggett McCall Properties, who are owners' representatives. They'll be helping us build the new building when we actually get the approvals to build. Michael will also be running the slideshow. Is that right, Michael?
Yep,
Well,
that's correct.
so
And
we
it
have
should be on the screen now.
We have a brief presentation. Okay, I'm not seeing it, but let me see if I can find it. There it is, sorry. Okay, what we wanted to do was just give a quick overview of the project itself and then discuss what is a geothermal well and how do you build a geothermal well. Also present some precedents. There are other geothermal well systems in Massachusetts that are installed in aquifers. And then we're hoping to leave plenty of time for discussion by the board. Next, Michael. So let me give a big picture explanation. Why did we want to put a geothermal well in here? Well, it's really part of the environmental goals that Mass General Brigham has set for its new construction projects. And basically, we don't want to be contributing to the health issues that we're treating our patients for. And in terms of buildings, the emissions from heating and cooling, using natural gas, obviously lead to, and we have plenty of health provider experience on the board, I can see, but asthma, cardiovascular disease, and emphysema, even cancer. So in an urban setting, we certainly want to be reducing our emissions. Part of the way we can do that is by reducing the amount of natural gas that we burn to heat our buildings. And one of the technologies that we are now utilizing is a geothermal well system, and that relies on the essentially constant temperature of the earth, around 50 to 55 degrees, to provide a heat sink for us. So we can put hot water down there in the, or heat down there in the summer, and we can extract that heat in the winter for heating the building. We're also going beyond the building itself into the furnishings and minimizing the use of toxic chemicals in our furniture and furnishings. And we have a LEED Gold certification standard for all of our new construction at Mass General Brigham. So this is the planned project, phase 2 of the Westwood ambulatory center. The existing building is over on the left-hand side, the 2-story gray building. The middle building will be a radiology, imaging, and surgery center. And then the building on the right-hand side will be a parking garage of approximately 300 spaces for our patients and staff. So I'll turn it over to John here to explain what a geothermal well is, how you build one, and what some of the precedents are for geothermal wells in aquifers.
Thank you, John, and thanks to the Board of Health for this opportunity. So just to get everyone oriented, this is a regional map showing the approximate location of the site, which is the red dot in the approximate center of the slide. The blue lettering you see and the symbols in the middle of the slide are the water supply wells of the Dedham-Westwood Water District. And the area over which the wells draw their water under extreme conditions, extended drought, is delineated as a Zone 2 wellhead protection area. And that's the outline in red you see. So that's where the area, that's the area over which the wells are drawing its water under those extreme conditions. And you're fortunate to have a very prolific, extensive, and deep inland aquifer, as much as 100 feet deep. That's fairly unique, again, for inland communities. Next slide, Michael. So geothermal, as it's known in the industry vernacular, if you will, is really a heat pump, and it's a ground source heat pump. As John mentioned, it's essentially exchanging heat between the subsurface and the interior of the building. So in the heating season, it's drawing heat from the subsurface, which is typically around 50 to 60 degrees, depending on where you are in depth. And then in the summer, when you're cooling the building, it's essentially rejecting heat to that subsurface. So as the fluids circulate in the piping, that temperature equilibrates such that the temperature of the water coming into the heat pump stays within acceptable ranges, which is what we're essentially designing for. And the heat pumps sort of work their magic, so to speak, and convert the moderate temperatures of the subsurface to usable heat for a building within limits, low temperature applications. And as John mentions, it's seeing a lot of play right now for its role in reducing reliance on fossil fuels, natural gas, and oil for the heating season. It essentially replaces that with the electricity driving the heat pump, which is where you get this term electrification. So there are a number of steps that are taken to reduce the potential for contamination of both the subsurface, groundwater, and surface waters, no matter where we're drilling. So we're using drilling muds that are inert. They're not the types that will harbor bacteria, which has been a problem in years past in water supply wells drilling. No solvents are used in the drilling process or in connecting the loops. And these are, we'll be speaking, the proposed system is closed. So that means it's not pumping groundwater like a well. No groundwater circulation is involved. You're essentially circulating water within the pipes, but they make no contact with the subsurface. And this project has committed to doing that with no additives. Some closed loops will use glycol, for example, to extend their operating temperatures, but we've committed to a water-only system. Next slide. So yes, again, during the installation of the vertical components, we're drilling down through the overburdened soils. We're using mud to keep the hole open, and then that's essentially flushed out once we reach bedrock. Steel casing is set within the bedrock to eliminate any exchange of groundwater between the overburdened soils and the underlying bedrock. Essentially seals off the system. And then once the loop piping is installed, we seal it with grout, a thermal grout that encourages the thermal exchange between the fluids and the subsurface. And in addition, particularly in aquifer areas and in areas where the rock is deep, we'll install a cementitious grout around that steel casing as an added measure of protection to make sure there's no exchange between overburden and bedrock groundwater. And as with any, like any construction site, the drill rig does have hydraulics on it. Very rarely you'll get a leak of those hydraulic fluids, and all responsible contractors are equipped with spill kits. And usually we're talking about a very small amount of fluid that needs to be recovered in the unlikely event of a rupture of one of those lines. Next slide. So the installation, once the borehole is drilled, we will install these loops, either a single loop or actually two loops in pairs off of a reel. These are sealed in the factory. They're essentially pressurized with air, and we can make sure that they're in fact sealed. before they're installed. The pipe is on a continuous reel. These sections have been welded with heat fusion. Again, there's no glues involved. And then once the loops are actually in the borehole, they are pressure tested to make sure there's no leakage. And we run water through them to make sure that they're circulating at an acceptable pressure drop. And then once those vertical components, they're typically connected in circuits. And so you see that pipe in the bottom left hand, that's essentially a circuit that's combining a number of these loops. And those will be tested separately before the system starts operating. Next slide. So again, during operation, we're dealing with a system that's circulating water only. We have very exacting and stringent requirements for the quality of that water. And once it's commissioned with a little bit of troubleshooting in the beginning, the systems are very maintenance free. And that's one of the real appeals of ground source heat pump systems. Leakage is very rare. It's usually like with any utility related to construction where someone has inadvertently ruptured a pipe. And as I said, since this is a closed system, no groundwater is pumped or circulated during its operation. Next slide. So again, we're circulating water only. I should mention that the DEP does allow additives, including glycol and ethanol. They're food grade, still not something you necessarily want in a water supply aquifer, but the DEP allows it provided those are food grade additives and the proper precautions are taken, namely that the borehole is grouted so that in the event of leakage, it's not moving out into an aquifer. But as I said earlier, with an abundance of caution, MGP is committed to circulating exclusively water within this closed loop system. Next slide. Yes, so we were asked at the last meeting, are there other examples, sites, towns where geothermal systems have been installed in aquifers? So we were able to find several sites, perhaps not surprisingly on the Cape and the islands, in very environmentally sensitive settings, big aquifers like what you've got. So we'll just run through a few slides. One of the larger systems, which consists of 50 of these wells or closed loops, 500 foot deep. It actually is circulating mix of water and glycol. That was done for Mass Maritime Academy down in Bourne. Coastal setting, you're in a high yield aquifer. And importantly, this was installed when the DEP still required that these systems be registered under underground injection control. So DEP was very much involved with this, and there were no water quality issues associated with the system's installation or operation. I spoke with him recently, the head of our UIC program, and DEP saw there was no monitoring required based on their review of the package. Next slide. So the Mass Maritime is probably the most comparable to the system we're proposing. However, there were a number of systems, also in this example, Martha's Vineyard, but in the Cape and the Islands, where open systems have been installed. And again, these are coastal settings, high yield aquifers, quite often quite close to public water supply wells. And we found no reports or no evidence of any water quality issues associated with these systems. And again, these are open systems that are actually pumping groundwater and recharging the heat pump effluent back into the aquifers. Next slide, Michael. Another one, Stowagon Bank. Not exactly in an aquifer area, but very sensitive coastal setting, required NIPD's permit for discharge of water generated during drilling. And again, no monitoring was required and no water quality issues have been associated with this. Next slide. Very small open loop system down in Mashpee, again in an aquifer area, close to water supply wells. Again, no water quality issues other than prohibiting any additives, which are occasionally used in these open systems to control fouling and scaling, that sort of thing. Next slide. And then the Dreamland Theater in Nantucket, also small open loop system, coastal setting, high yield aquifer. And again, according to the designer, there have been no water quality issues, and no monitoring was required by the town associated with that system. And that's what I've got. Be happy to try and answer any questions you might have.
So perhaps just to, this is John again, perhaps just to reiterate what the installation would be. It would be a closed loop system, meaning that there is no water being taken from or discharged into your town aquifer. Closed loop means it's not unlike the radiator in your car. It's just the same fluid circulating backwards, going through your engine and going out to your radiator to cool down. And it's the same fluid that just keeps going around and around and around. And so that's essentially the same system we are designing for, or proposing to design for Westwood. Those pipes, those plastic pipes are inside a 6 to 8 inch steel pipe. That steel pipe goes from the surface all the way down to the rock and is embedded in the rock at 500 to 600 feet down. The steel will be passing through the aquifer, so there is no interaction between our system and the aquifer other than the steel pipe going through that aquifer, and that's not unlike the steel. That would be the same type of steel pipe that you're using for your town wells, presumably. And then finally, we're using water to circulate through the geothermal system, so there are no chemicals involved. And so even if there were a leak of our system, the only thing leaking out would be water, nothing else, and it wouldn't get out of the pipe anyway. So it would be any leakage would be within the confines of the installation that we have built, would not leak outside of that. So our view is that we are not using any contaminants. We are not using anything nor doing anything that would contaminate your aquifer. But obviously, we can understand your concern and be glad to take any questions you may have.
John, if I could jump in, it's Jared. I don't know if you can see me.
I can.
So I know my board was not present at previous meetings. So if we could just kind of rewind slightly for their benefit. The last time I was on with you folks, you had advised there would be something like 130 individual boreholes. Is that still?
No, nowhere near that. We won't know the exact number until we do a test well, and what we would be requesting from the board today is permission to proceed with a single test well. But our expectation is that there's somewhere between 24 to 36 wells. I mean, conceivably as many as 50 wells, but and again, see, these are 6 to 8 inch pipes, but we have to make that determination, but nowhere near 100 pipes, and certainly not more than 100 pipes. Yeah.
Okay. And do you have an estimate on the energy savings or the energy, diversion by using this system as opposed to, a traditional gas or electric?
Yeah, and that is what drives the number of wells beyond a certain point. So I'll tell you about a different site where we are installing geothermal wells, and to eliminate 90% of our gas usage, we have 24 wells. to eliminate 95% of our gas usage, we have 36 wells. So, our goal is to eliminate at least 90% of our gas usage. And then it becomes an economic question after that. Basically, the extra 5% has to do with peak days. And in this instance, it's peak cooling days. It's those days that happen occasionally, once or twice a year, where the temperature gets down to 0 or below, and we need the capacity we have to provide more heat, basically, of course, just like you do at home. But for most of the year, both for heating and cooling, we ought to be able to operate on fewer wells, and then only need all the wells, the full capacity of those wells or boreholes on the coldest or hottest days. But the goal is 90% reduction, minimum 90% reduction in the use of natural gas, Jared.
Okay, and the lifespan on the tubing?
I'll let John answer that.
Yeah, the manufacturers, they're essentially warranting it for 50 years. So, and there aren't many systems with that kind of track record here in the Northeast, but there have been thousands of systems for homeowners and some commercial properties all over the country. And there are definitely some systems that have that sort of a track record, 50 years or 50 years plus.
Okay. All right, anyone on the board, do you have any questions for the presenters?
Looks like Shelley has her hand up.
Yes, John, thanks for the presentation. I was wondering if we could get a copy of the slides.
Sure, absolutely.
Great. If you could send them to Jared, I think he'd be able to distribute them to us. Thank you.
Sure.
You're welcome.
I can't see. Go ahead.
You speak of our aquifer at being 100 feet deep, and I wasn't sure I could understand how you got through that without disturbing the aquifer, getting down to the 500-foot depth that you seek.
Right. So, the contractors that are installing geothermal systems, they really come out of the water supply well drilling business. They're not geotechnical contractors. So they've got big machines that are what's needed essentially for drilling through rock, especially to these depths. So the typical procedure, and it just has turned out over the years to be proven to be the most cost effective, is to use a drilling mud that essentially keeps the hole open. It keeps those sandy soils from collapsing on the borehole, so that they can advance the borehole till they reach bedrock. And then you can picture they essentially create a socket in the rock. We typically require 20 feet. So they'll drill down with that equipment 20 feet into rock, pull out the bit. And again, the mud is what's keeping the hole open. And then they'll advance a steel casing, socket it into the rock. It essentially has a shoe on the end of it that gives it a good friction seal. And then the annulus, or the space between the casing and that open borehole, is then the mud is displaced and replaced with a cement grout. It's not unlike concrete. It's a little bit more liquid, so that they can actually pump it down this small annulus. And then once that sets, they have a solid seal between the steel casing and the cement grout. And that at that point, they switch over typically to a method we call air rotary, which now replaces, instead of circulating mud, they're essentially using compressed air to clear the borehole of the rock cuttings as they're grinding up the rock, advancing through the hole, and as well as any groundwater that's encountered in the bedrock, because at this point, the groundwater, the aquifer, has been sealed off. once they're down in the rock.
And those rock fragments then come to the surface and are spread somewhere?
Yes, so good question. They will build a pit, and then usually there's some, and that can be lined. In this case, I would certainly recommend that it be lined. And then some combination of that pit, and if they need it, some tanks. The water is essentially circulated through those so that to allow the rock cuttings to settle out. And that achieves two things. One is it keeps the rock cuttings in one place so that they can be essentially hauled off site at the end of the program. And then it also settles out any fines that are in the water so that we can discharge that water typically to a storm drain and meet the EPA's requirements for suspended solids or dissolved solids that are reaching the surface water.
Thank you. What about that situation where a loop does break and you say you take it offline? Do you then withdraw the whole system from that particular bore?
Yes, so there's usually with these larger systems, there's a fair amount of redundancy, often to the point of where the mechanical engineer will make sure that the system can operate, that you can heat and cool the building, even if you lose an entire circuit. Because if you get leakage, it affects more than one loop. It'll affect 4 or 5 or however many loops we put in a single circuit. But 90% of the time, if there's a breach under operating conditions, it's within one of these lateral lines. So much like any utility, you isolate the circuit, and you essentially have to excavate to find it, seal the loop to get the circuit back and running. But it's very, very rare that any of the vertical components down in the subsurface, the loop itself, would breach under these operating conditions.
Thank you.
You're welcome.
So one more, Carol had a question. She's still having a little feedback on her device. So she had asked if we could go back to the slide, which shows the parcel footprint, and we can identify where the well field would be located in relation to the building. Can we zoom in on that or no?
Well, the well field will be right in front of the building. It's basically under the existing parking area.
Okay.
It's
Yeah,
out
it's
there
hard.
now. Yeah.
Sorry, this is not a very high
Yeah.
resolution image because of the size of the file.
I understand. All right.
But
So
when we send Jared, when we send you the presentation, we can include a more detailed drawing of the location of the site location.
okay.
Yeah, so in case anyone's curious, we will usually select an open area as opposed to trying to shoehorn it into a small space or under a building. We want to be able to access it. Again, in the rare events of a leak in those laterals, we want to make sure that the system is accessible.
Right, and the parcel is going to be built upon it also, right? So what's there now is going to be the parking, right, and the additional buildings are going to be added to the rear of the existing structure?
To the side
Yeah.
of it. Yeah.
Side, okay, yeah.
Yes. And of course, all the wells will be on our property. We're not proposing to go on anybody else's property to install the well field.
Mhm.
Yeah.
Right. Right. So, obviously we discussed previously, it's in a sensitive area for the town. We've been in communication with Dedham Westwood Water. I think, we're trying to deliberate on the appropriateness or the sort of the risk tolerance that we would have by stewarding the public water supply. My position still is that our town bylaw would not allow a well of any kind to be dug on this parcel. Our town attorney has supported that. So I'm not sure, in my opinion, there's a path forward for this type of project in this particular location. You know, I appreciate the, you know, the idea behind it. Obviously, we're all striving for net zero. But, you know, we're, I guess, still trying to formulate our full position on that in consultation with Dedham Westwood Water.
Yeah, I think, Jared, just to clarify, you know, at least I don't know what the legal definition of a well is, but typically that's something where you're extracting water from the ground.
Right. Yeah.
We're not extracting any water, nor are we discharging any water in the ground.
Right. And I think, you know, that conversation, I think probably will need to be, you know, had, you know, the way our private well regulation, you know, reads, you know, it can be considered, even though technically it's a borehole and not a well, you know, per sort of the newest iteration, granted that our regulations were not written when geothermal wells were commonly installed. So I think there's still room to discuss that with town council. You know, so I think we're moving it forward. I'll be curious to try to extract some documentation from these communities where you have these sensitive, environmentally sensitive sites, so we can sort of glean what they were, you know, reasoning during their process, which ultimately led to approval. So, I mean, that's kind of where I am at, feeling like any of our public drinking water supply is sacrosanct, and it's difficult for me to look at this project, as laudable as the goal is, and feel like it's a feasible project for the town. But, you know, I'm not ready to make that position, and my board has not obviously made a position on that. But, you know, that's just sort of my sense of my feelings on this.
And let me say, just on behalf of Mass General Brigham, if we believed we were putting your water source at risk, we would not be here asking you for permission. That's, you know, that's antithetical to both what this project is about and just what the whole mission of the hospital system is about. Again, we're not trying to put anybody at risk here. So, you know, we do believe that it's safe, it can be installed safely, and it can operate safely. But I understand, again, that you all need to do your own due diligence and convene. And, you know, our request would be for permission to install a single test well, just to see what kind of design criteria we're able to extract from that test well, and design the rest of the system. At the same time, if you are not interested in entertaining this request, then we'll take it off the table.
Okay. I think at this point, you know, I can only speak for myself, that we would still prefer to deliberate and let my board have adequate time to do their due diligence and come to a formed opinion. You know, we certainly wouldn't want to agree to something of this nature also without posting it on the, you know, on the agenda and allowing for public comment. So, you know, I think if we were able to do that, we would want to do it at the June meeting, so that the public will have ample notice to be notified and give them an opportunity to weigh in as well. But I think we do want to do more research. You know, we want to have all of the knowledge that we can acquire at our disposal, because, you know, it's a community partnership. Obviously, you know, we are looking forward to a full examination of the facts.
Thank you. That's all we can request.
All right. Thank you very much, John.
Thanks, Jared. Thank you, commissioners.
All right. Thank you, everyone.
Very much.
Thank you for having us. Thank you.
Thank you.
All right. I will
water.
Does anyone want to have any further discussion at this point in time, or should we move on our agenda as noted?
We're glad to leave if you'd like to kick us out.
Okay, can you exit yourself or does Paul need to boot you? Okay, thank you, Paul. All right, I don't know, why don't we hold unless, and kind of digest what we were presented with. Obviously, there's still communication that needs to occur with Dedham Westwood Water, before, I guess, ultimately, we would entertain the idea that we would allow for a test hole to be dug there. And so, you three obviously tell me which direction you want to go, but at this point, I would prefer we probably move forward to the next agenda item.
Has Westwood Dedham Water weighed in on this at all?
Anecdotally, we've had sort of cross conversations. The studies, I guess, that were delineated in the slideshow from those communities that were mentioned, we were anticipating getting that information well in advance of their presentation, so we would have an opportunity to review it and also reach out to the towns where those wells or geothermal heat pumps are located, and have an opportunity to engage with their local health people and get a sense of what they're encountering. Some of the things were mentioned, testing. Well, there was no opportunity for us to sort of preview that information. So I'll be anxious to do that probably next week. Start to reach out to those folks and get a sense of what the process was there.
All right, thank you.
What's up, Shelley?
Yeah, I would not be in favor of approving a test well, and I'm not sure if we need to take a vote on that, or is just by not taking any action, is that essentially at this point putting that off?
That's a good question. My expectation was that, once they would apply for a permit, then at that point we would take it up. But we have been tasked to make a recommendation to the planning board. So, if we consider that, I would, we consider that we can, you three can come to a consensus and we can make that opinion known to the planning board via memo, that, the Board of Health would consider, not approving a project like this at this site for, a host of reasons. But I would prefer to draft that. We can take this up certainly in June. I would prefer that it was posted on the agenda, just to allow the community and to have the opportunity to weigh in. And then at that moment or that time, if a vote is appropriate, we can entertain it at that point. Like I said, I was anticipating getting these parcel well installs that were on the Cape in advance, so we would have the chance to review them. But they were not provided to us here at Westwood, maybe somewhere else. But I checked with Eileen last week and she hadn't received anything either. So that is important to us to review, to make sure that we're properly exercising our authority.
That sounds like a good plan to me.
Okay, thank you. All right, so shall I move on?
Please.
Okay, so COVID-19 health report. So I've got a few items to mention briefly. So an important development, the Pfizer vaccine has been approved as an emergency use authorization for residents that are 12 to 15 years old. So residents can visit the vaxfinder.mass.gov to make an appointment or pursue an appointment for Pfizer vaccination at any other participating site, such as a pharmacy or clinic that's operating and is offering the Pfizer vaccine. The Pfizer vaccine is the only one so far that's been approved for EUA for that age group. So as of right now, that is the only option for children in that 12 to 15-year-old age group. Children can go unattended as long as their parent provides a consent form, which is signed to be vaccinated. So, you know, some of the folks had mentioned that I've spoken to that the appointments were available, you know, when you know, parents were at work and they couldn't get there, or they were going to have a sitter or a nanny or someone else, and, you know, do I have to be there? So the answer is no. There's a consent form that can be filled out and signed in advance. So then your child can take that form to the vaccination site as a stand-in. So I think that's important to mention. Westwood cases have been on the decline for a few weeks in a row, which is great. Our percent positivity has dropped back down to 1.4%, which is great. You know, 17 new cases in the previous 14-day reporting window, which had dropped, I think, 3 consecutive weeks. We were up to 32 and then down to 30 and then down to 26 to 22. Now we're down to 17. So all in all, you know, warmer weather, more folks being vaccinated. A lot of these things are helping to start to get us in line. We're finally green again for the first time in a while. So our color-coded risk designation is back to the green level, hoping that we can stay there. Vaccine, 8,000 of our residents have been fully vaccinated for COVID-19, and 10,000 approximately have been received at least one vaccine dose. So, you know, pretty soon we'll have a very large percentage of our residents vaccinated, which will be great. And we will have a pretty large proportion of those who are eligible. So I think residents have, you know, have chosen to participate in vaccination. So that's been a welcome sign for us here on our level. The other big news, obviously, the governor had spoken yesterday or the day before on there's the revised reopening. So as of, you know, May 29th now, we'll be looking at you know, some fairly significant changes to what we've been doing so far. So, you know, most notably the mask mandate will become a mask advisory. So then mask wearing will no longer be required unless it's in a specific location, which will be delineated. I believe it got released today, which is like public transit, congregate care facilities. There's 8 or so different places where the mask mandate will remain in effect. But starting the gathering limits, any restrictions on businesses in terms of crowd size, spacing, distancing, will all be rescinded on the 29th. So we are looking very close to pre-pandemic levels of activity, which obviously is welcome news for us. We still have specific guidances for different activities, summer camp, youth sports, different, sort of different DESE school guidances. Those are still going to be sort of in their own little lane. But for the general townspeople, we will be looking at sort of an openness beginning on May 29th that we haven't had since the state of emergency was declared. So looking forward to that, looking forward to the cases decreasing. June 15th, where the governor is expected to rescind the declaration of a state of emergency. So I'll be communicating with the three of you as we get closer to June on the appropriateness at that time of rescinding our own Board of Health declaration of a public health emergency, which we had signed in last year around this time. So that will be a little more concrete as we get closer to June. So a lot of good news out there. Obviously, we're still paying attention to variants of concern. We're still paying attention to looking for hotspots or outbreaks. But we are seeing things starting to loosen up, and the confidence, I think, in public health officials locally statewide, both seem to feel like, we're finally looking at, the end of the road here in terms of wholesale, work being done on our level to reduce the spread of the virus when vaccination levels get to, as close as we can get to herd. Hopefully we can get there, but, I still don't know. We'll be back to sort of where we were before. So, that a lot of that is going to be coming through. A few more things will be coming. We're still contact tracing. We're hearing will be slightly revised, but that hasn't been communicated to us yet. But early indication, at least in the school setting through the DESE guideline, is that outdoor close contacts will no longer be subject to quarantine. So in part with the mask removal, which DESE has promulgated for outdoor learning, recess, or gym class, their masks are not required and social distancing is not required. Any contacts identified in that setting would not be subject to quarantine. So we're moving it forward. I think inside the office, we're very optimistic. So I don't know if any of you have questions about where we are right now.
About the Council on Aging, where do they stand?
So we're meeting, a few of us are meeting tomorrow to discuss their reopening plan. They do have a reopening plan that we met on, I think it was a week ago. We spent a considerable amount of time reviewing the plan that was created. Obviously, with May 29th now being the new August 1st, that might free them up. If their schedule and their plan doesn't prohibit them from doing so, reopening sooner than maybe they planned. But I certainly don't want to speak for them. But there's nothing at this point after the 29th that would prohibit them, from doing what they plan to do, sooner.
All right, thank you.
Same with the library.
Yeah. Good.
Shelley? No? You good? Okay, I'm sorry. So that's all I have on COVID. I think I jumped over Margaret. I apologize. I could have used the break too, so I apologize.
Well,
So
thank you.
Margaret-
You're eager to finally share some good news. I can understand.
Yeah. I was judiciously working through my notes and was definitely anxious to share what I heard today on our DPH call. So
Right.
all right, with that, I will be quiet for a minute. Margaret, please.
Hello, everyone again. All right, 3 quick updates. One is that our tuberculosis case no longer requires direct medication observation. This is a town resident that successfully completed a course of 6 months of direct observation medication. And is doing great. So that case is closed. It was a great collaboration with the local Board of Health, the Mass Department of Public Health, the case itself, and the infectious disease community. So it's a success, and we're going to move on. Another case of Campylobacter, which we talked about before, relatively common in the United States, about 1.5 million cases in the United States a year, diarrhea. For the most part, also fevers, belly aches, but easily treated with antibiotics after you have a stool culture that determines what it is that's actually growing. Our last case that is new to us this year, but I'm sure it's come up in the past, is a case of human granulocytic anaplasmosis. which are three very large words. Just basically, that means you've had a small tick bite and has caused a disease. Again, similar to Lyme disease and can be screened at the same time, the black-legged tick causes high fever, chills. Some of the highest fevers I've ever seen have actually been because of human granulocytic anaplasmosis. Typically starts a week or two after a tick bite. We do, ticks are active all year round, but this is the time of year from April to September where we see more tick bites at its height, June and July. Ticks require typically 24 to 48 hours to transmit disease. So it's just a great reminder to cover up when we're outside and to check your skin when you get indoors, because if there is a tick, there is time to remove it before disease kicks in. So again, that is tick-bearing disease, but again, easily treated with antibiotics. And like every other disease, I feel like we talked about, it's fever, chills, body aches, and God bless our primary care teams because they've got to sort through. I feel like everything we've talked about this year has included those symptoms. So we're, giving them a lot of work, including COVID, right? So fun fact about ticks, because we want to make science fun, they're actually arachnids. So they're part of the same group as spiders. So if you look at them and you think they're gross and you're looking at it and saying, ooh, is that a spider or a tick? You're right, they're arachnids. So they're very similar in the way they look. And here is our last thing. Jared, get ready. You are our quiz winner last time. We'll see if you can still wear the crown. What is the main way for, this is multiple choice, so we'll make it easy. The main way for ticks to detect a potential host. Vibrations from walking. The first tick comes across a host who performs a dance for the other tick. So essentially one tick alerts the other ticks. Ticks have exceedingly keen eyesight, or carbon dioxide from a host's breath. So vibrations, carbon dioxide, one tick alerting the others, or they've got great eyesight.
It's someone else's turn this week, right?
Come on, Jared.
Okay, I was always told they just lay on a leaf or a blade of grass and wait for something to walk by. And that's the extent of their predatory behavior.
Anybody else?
I'll try CO2.
There's the man of science. All right, you win the crown this month, Dr. Christian.
All right.
Yep. Okay. Good job.
Thank you. It was a
Okay.
guess.
A very good one. Is that everything on your?
That is it, unless you've got more for us.
No, there was a question in the chat I wanted to comment.
Yeah.
So the question in the chat was asking about town hall reopening. So the departments, those decisions will be announced by the town administrator when they are finalized. So obviously we're in consult with various town departments and buildings and all across the board here as the Board of Health and the Health Department to advise folks on what the regulations require. Those buildings, all town buildings will be eligible to be open full-time after the 29th, but we will defer to the town administrator to make a formal announcement on the reopening of those buildings when it's appropriate. So there is more to come on that from that side. So that's everything I think that we have. Paul, is there anyone in the chat or in the viewer side that has a hand up?
Nope.
Wants to ask? No one?
That you haven't answered.
Okay, great. Jason, do you have anything to add?
Just to piggyback quick on the town hall opening, we are open by appointment too, if there was anything that person needed specifically.
Yeah.
Just to throw it out there, but otherwise, besides that, nothing really to add, just plugging along as I normally do.
Okay. Yeah, so we are in the process now of swimming pool renewals. So we have the outdoor pools trying to get themselves ready to be open for their seasonal permits, and then we'll do the year-round pools as well. Spas, hot tubs are still not up yet, but they will be soon be eligible for reopening. So when appropriate, people holding spa permits can apply, and we can inspect them and permit them to reopen when they are ready. Summer camps will be the focus that we turn to next. Obviously, there is still separate guidance for summer camp in addition, to the traditional camp guidelines. So we will still have some COVID-19 regulations in place via the camp documents, but it won't be as strict as it probably has been, and certainly won't be as strict as it was last year. So it'll be more close to normal camp experience for all those people participating, but there will still be some regulations in there for COVID. So we'll get started working through that pretty soon after the pools are done. And the last thing I want to mention is that we do have potential interest in an applicant for a body art license and a body art practitioner's license. Those folks are, the practitioner is a permanent cosmetics technician and is looking to get a license to practice micropigmentation in Westwood in a facility that's going to apply to host them. So those applications are sort of in process. Once they are complete, we will do our review, and should they meet the eligibility criteria, we will ask them to attend the June meeting, where you can review their credentials, and you would have to vote on permitting them to have those licenses. So we'll follow up on that as soon as we're able to get their paperwork together. I've been speaking to both parties for a few weeks now, and they seem very close. So my anticipation is they will be eligible once all the documentation has come through. And we'll give you a little follow up. We haven't had any, I don't think, in a while in town, and certainly none since I've been here. So we'll do a little follow up, a little primer on that too, just to remind you all of the ins and outs, because it took me a few minutes to go back into my old notebook to remind myself of all the requirements for bloodborne pathogens, physiology, and those types of things. So with that, I have sure.
Is micropigmentation known as tattooing as well?
It is not. It is a separate form of. It uses a needle, but it doesn't penetrate down into the additional layers of the skin like a tattoo needle would. The depth of the needle doesn't reach, so they call it semi-permanent. So it does show fading after a period of years, and does require additional treatments over someone's lifetime. After a few years, it does start to dwindle. So it's not typically it's a single use needle that's used to put the pigment in under the layer, the first layer of the epidermis, and it's not a air type of tattoo type. It's disposable, single use, something quite different than what a tattoo would be. And typically they're disposable, so the autoclave and the sanitation requirements and all those things aren't usually in play for this type of service. So in a way, it's a little bit easier to manage than a tattoo artist, but in a lot of ways, I'd say 90% of it is the same requirements, because you still are puncturing the skin with a needle and injecting an ink. So it's very, very similar.
I'll be eager to learn all about it.
Great. So I think that's everything for me.
Good. Anyone else have anything they want to add? Hearing nothing, do I hear someone that wants to end the meeting by making a motion? We adjourn.
Injecting an ink.
I'll make the motion. I say we adjourn. Any second?
Second.
Thank you. All in favor,
Everything from me.
Aye,
please say aye.
Carol Ahern.
I, Shelley Weaver.
And I, Roger Christian. The meeting is adjourned.
Thanks,
Thank you.
everyone.
Thank you, everybody.
Nice to see everyone.
You
Have a
too.
good
Stay safe.